Welcome to the first video in the IAOMC Fellowship Series. This video will describe the reasons for wanting to go on this journey as well as the skills and steps needed. So let me take a moment to explain to you why it would be a great idea to start this journey. Well, first of all, it's a practice builder. When patients look on the website looking for a doctor who fits Ortho-K molds, then they see your name prominently displayed with a little red tag by it saying you are a fellow of the Academy, and the description of the fellow indicates that the person is an expert in fitting and they've gone through extensive testing. Also, of course, the studying process increases your knowledge, which is a great thing because you're thinking you know everything about Ortho-K, but when you're actually forced to study it in detail, you find out you don't know quite as much as you thought you did, and your knowledge gets expanded, which of course is great for fitting contact lenses and for troubleshooting in a much more effective way. Also, you're viewed as an expert by your patients, an expert by your staff, and that of course increases the fact that people might choose you to fit their lenses over others. You have that crazy FIAO attached to your name, and that is a conversation starter because the patients will ask your staff, well, what does that mean? And the staff can then, if you have properly trained them, go on and brag about your credentials and how you're a fellow and how you're an expert, and that's always very, very good for you. And then, of course, finally, the transfer of care. When one of your colleagues refers your patient into their patient into your area because they're relocating, they're going to go on the website and look for a doctor in the area, and if they see this red tag fellow, they'll probably choose you because you are viewed as an expert. It will do a better job of transitioning care for the patients. So I hope I've showed you how the FIAO can actually be a wonderful value-added advantage to your practice. So what are the skills necessary to apply for and attain a fellowship in the Academy? Well, first of all, you have to be an absolute expert in the design of an Ortho-K lens. That means you have to know the function of every single curve on a multi-curve lens. What do those curves do? How are they manipulated to make a change in the fitting? How are they manipulated to make the lens fit better in the very beginning? If your lens of choice doesn't allow alteration, then you have to know how to manipulate those curves on a theoretical basis. So we might give you a lens design and say, hey, tell us how you might fix this particular fit exactly by manipulating a particular, let's say the alignment curve. And you are going to be obligated to be able to describe that, even though in the way you fit the lenses, that's not done. You have to have a comprehensive knowledge of topography. That means every single type of map that's available in any kind of topographer that might be out there, and why you would choose a particular map for decision making, especially in pre-fit analysis and then again post-fit analysis to see what your treatment effect has been, and then in troubleshooting, how you use the topographic maps to determine where you go in terms of the fitting. And what do all these data mean? It'd be able to explain that really in extreme detail because we're going to ask you. And of course, remember we talked about earlier that you have to be able to either fit two Ortho-K manufacturers or one that's fully modifiable. And the reason we say that is because you can't just expect to be an expert and fit only one lens, have knowledge of only one manufacturer. You've got to have a little bit of breadth of knowledge here. And if you're fitting one that's fully modifiable, then that is a full breadth of knowledge. So just either do two of them or do a fully modifiable lens. And we don't care whose companies you fit. We just have to have the knowledge there. Troubleshooting. Well, of course, you have to be able to identify the cause of the problem, and then you have to be able to explain how you would manipulate all the curves and why you would do it in order to fix that problem. Recognize complications, and it would be nice to be able to recognize them before, but of course we can't always do that. But what are the causes? What caused that particular complication to happen in theory, and then how are you going to fix that? And of course, use of the sodium fluorescein patterns in diagnosis and also in fitting. This is going to be a very important part of the exam, so you have to be able to be an expert in this sort of analysis. complex designs. What you have to do is show us that you have a great deal of advanced experience in fitting ortho-K designs. And they can't just be simple designs because that doesn't show your skills as an advanced orthokeratologist. We've listed a bunch of different types of cases that might qualify as challenging or interesting. You can't just do a high myopic slam dunk case. It doesn't work that way. We have to know that you have identified some serious, interesting challenges pre-fit, or that you've had challenges during the fit. Show us your skills. Don't just make it easy because those don't qualify. Let's take a moment to go over the testing protocol for the fellowship process. First of all, you have to complete the mandatory prerequisites, and if you feel that you are ready to go forward, then you complete an application and you include a case abstract. We'll discuss what that involves in the next slide. If you are selected as a candidate, then you go on to complete the elective choices, you pass the oral exam, and then you have your fellowship conferred. What are the mandatory prerequisites? Well, first of all, you have to provide proof of fitting 50 ortho-K cases, and that proof can be pretty much just about anything, but you have to be able to prove it. Usually people ask their manufacturer just to give them a list of all the cases that they've ordered. You have to own and use a topographer, and you have to have been a member of the academy, any section but of the academy, for 2 continuous years. You must have attended boot camp, but if you've done more than 100 cases, then the boot camp requirement is waived. And you must have attended one of the IAOMC section meetings within the last 3 years. And we note here that COVID exception may apply because we haven't been able to hold any meetings. And so we will discuss that when you make your application. But if you've at least done a meeting at some point within the last 3 years, that would be good. So we just have to see what's going on with COVID. You have to use a minimum of 2 different manufacturers unless you're using a fully modifiable software, and then you don't need 2 different manufacturers. Because most fellows really need to have a breadth of experience and not just stick with one single manufacturer. And then, of course, if you are a member of the Asian section, then you have to have attended the rank of senior fellow in their academy. What are the steps for submitting an application? Well, first you have to request an application from your section fellowship chair, and the names are listed here currently. If your section doesn't have a chair or you don't belong to a defined section yet, and some of the places in the world don't have a section at this point, then contact me and we'll make arrangements to get you tested in one of the particular sections that's giving a testing exam in the next coming months. Now, make sure when you fill that application out that it's filled out completely, because it's quite long and extensive, and it helps us to understand your qualifications and who you are. But before you submit it, make sure that you do meet the qualifying requirements, because that's very, very important. Submitting an abstract. Well, the instructions on how to do this are on the website, but also they are attached to the application. Basically, you select a case that will showcase your fellowship abilities. Don't pick a simple case, because that's not going to showcase anything. Anyone can do a simple case. You're a fellow. Show us what you can do. So you prepare this abstract, and we have an abstract form that's also attached to the application. It just basically asks for probably 5 or 6 different things that have to do with the case, including adding in a topography, a JPEG of your topography right into the template. Anyway, the instructions are on that page, and then once you have done that, this abstract is going to be used for the committee to decide if you are going to go on for testing, because we get a lot of people applying, and we have to have some way of knowing who will be the most likely to succeed in going to from candidacy to fellowship. And this is one of the good ways, because we can then see what sort of cases you're doing, and then how are you preparing it? Is it sloppy? Is it easy? Is it easy to follow? That sort of thing. And so you've got to show us what you can do by submitting this abstract. What you're seeing on these next two slides are basically samples of abstracts that other people have done with complex cases, and you can see how brief it is, but also it's quite succinct. And so these are the kind of things that we want you to use as examples so that when you prepare your own abstract, it will be done very well. The elective requirements have been established because there are two groups of members who might apply for fellowship, clinical and academic. If you're clinical, then your elective requirements can be met by passing the multiple choice test with a score of 85%. If you're an academic, you have the option of attaining your points through a combination of choices, but of course they must be in the field of ortho-K and myopia control. Now, if you are chosen, you will be contacted by your section fellowship chair, and this is where your study preparation begins. If you aren't chosen, you've got to realize there are only so many testing spots in the academy, and so your section fellowship chair will contact you and explain why, but sometimes it's just a matter of the fact that we don't have enough testing spots open, and there's nothing wrong with your qualifications, we just don't have enough spots open. And of course you can apply next year, no problem. We will ask you to study and prepare yourself extensively for the written and the oral panel exam. You'll do that with a list of books and articles that we'll provide you, as well as a video study guide listing all of the different items that will be covered on the written exam. And then also we'll provide you with access to a mentor reviewer who can answer some of your incidental questions. The Fellow Study Group. Now, you'll be provided with lots of references for how to prepare, including a PowerPoint on every single topic that's going to be tested, found on the multiple choice and the oral exam. And so you have an idea of what's going to be on the test. But if you would like, you can join one of the study groups, and there'll be all of the people taking the test will be on this study group. And you have to be crazy not to want to join, but you don't have to. I mean, you could prepare on your own. What happens then is we take all the topics that are found on the test and we divvy them up among all of the candidates. And sometimes that's like 3, maybe 4 different topics. And each of you will then prepare an extensive PowerPoint on that particular topic. And then when you have submitted them to the chair, we will look them over to make sure that what you prepared and you're going to share with the rest of the group is accurate. Because sometimes there are some mistakes and it's like, oh, good, let's share that with everybody and look silly. And so we do review it. And then once you've submitted all 4, then you will be able to receive everything that everybody else is submitting. So it's it's kind of like a chain letter, but what you do is you submit 4 and you get back 30, and you use those to study because that's hitting each topic in depth. And what this does is really does help you to study better, because you can look at things and think, oh yeah, I didn't know about that. And so it does increase your knowledge in terms of preparing it, but also just reading what everybody else has prepared. And sometimes in the study group, because you'll have an online study group, someone will say, hey, I'm looking at this particular PowerPoint and I'm not sure I agree. What do you guys think? And then you'll all discuss a topic and come up with the right answer. Anyway, that is something I highly recommend that you join. We come to the multiple choice test. That is a series of multiple choice questions that cover all of these different topics right here. It's very extensive, and you must pass with an 85% based on a curve, and if you do, then you will immediately go into your oral panel exam. The oral panel exam. Well, let's hope you have something more to say than just wave at everybody, because this is a very, very important part of the testing process. The oral panel exam. The first part regards the cases that you have submitted, cases 2 and 3. You submitted them and they were accepted by your panel. If they hadn't been accepted, you would have been required to do them over again. So they've already read your cases, so there's no need to make a presentation. The first part simply is going to be where your panel asks you questions about your cases, and you have to really be intimately familiar with the cases and any of the questions that they might ask, because they're going to be asking you, why did you pick this particular design? Or you troubleshot it and you did this. What other ways might you have achieved the same result? They might talk about the outcome. So there's a lot of things they'll be asking you regarding these particular cases, and that is where you get to show your brilliance. The second part of the oral panel exam is a section called the practical section. And what you will do is be viewing various maps and sodium fluorescein patterns, and then answering questions from the panel on what you see, what regards the treatment, the outcome, and analyzing the fluorescein pattern, all sorts of different questions, but on real cases. The panel will also give you a lens design and ask you how you might modify this lens design to better achieve myopia control. So if you pass both sections of the oral panel exam as well as the written exam, you have your fellowship. Yay! So there you have it. This is how you apply to become a fellow of the International Academy of Orthokeratology. Are you up for the challenge? Let's go for it.